radiology completely, be it through practical workshops, seminars, research-based workshops. And AIMCRad also introduced a mentorship program in 2023 with highly qualified radiology professionals who were actively there to guide students individually. And this webinar is basically a collaboration with Radiological Association of Pakistan, RSAP. And now they will be presenting their introduction, and then Dr. Awan will join us for the discussion. And I hope this session would be useful and a source of inspiration for all of us. Thank you.
Hello, Assalamualaikum everyone. My name is Ermeen Masood. I am the Secretary Treasurer RSAP, and today, along with Dr. Rana Mohammed Ehsan, who's the chair of the board, we're going to be briefly giving you guys an introduction about what RSAP is. So, as most of you guys know, RSAP stands for Radiological Students Association of Pakistan. It's the first of its kind and also the only radiological organization in Pakistan that is represented by the students. It was founded to unite aspiring radiologists and trainees throughout the country and as well internationally. RSAP was established by Dr. Salan Nadeem and Dr. Ali Hasnan, who are the co-presidents and co-founders, who recognized that the need for such an organization exists. And I'm so glad that they came across this idea and they brought it to life. We're also congratulated and acknowledged by RSNA, which is the Radiological Society of North America. So the RSAP membership base, we currently have like 300 plus members and counting, and we have members from like 35 plus medical colleges and universities all across Pakistan, like all the 4 provinces of Pakistan. This is just a list of the medical colleges from where we have the members from. There's Punjab, KPK, Sindh, Balochistan, Islamabad, Azad, Jammu and Kashmir. There's like a long list of these medical colleges. So the RSAP has like 3 working committees. There's Research and Publications Committee, there's Mentorship and Education, and Advocacy and Networking. So briefly talking about the structure of RSAP, first up, we have the board of directors. There's Dr. Salan Nadeem and Dr. Ali Hasnan, who are the co-president and co-founders. There's Dr. Rana Mohammed Ehsan, who's the chair of the board. There's me, Ermeen, secretary treasurer. There's Ali Azlan serving as the DPRC. Khaja Abdurrahman, director for human resources. Alina Ahmed as the liaison for research and publications. Ahmed Abdullah as the liaison for advocacy and networking, and Momina Javed Awan as the liaison for mentorship and education. Then we have our esteemed board of advisors, and Dr. Omer Awan happens to be with us, who are here as our guest speaker today. We're really happy to have you, sir. Then we have our associate directors. These basically serve under the directors for the committees. We have, moving on, we have some ambassadors. And basically, ambassadors are the ambassadors are the ones who represent us from different medical colleges. And moving on, we have some radiology interest groups that are affiliated with RSAP. There's AIMCRad, the one who's hosting the webinar in affiliation with RSAP today. There's one in King Edward, there's one in Sims, Shalimar, Sheikh Zayed, and Khyber Medical College. And then we have also officially partnered with Data Camp, AMBOSS, and Bootcamp. And I will be handing over to Rana Ehsan. He's going to give you the rest of the intro. Thank you so much.
Assalamu alaikum, everyone. I hope I'm audible. And good morning to you, Dr. Omer Awan. I hope we're not bothering you too much, taking your time out for this seminar. So with just try to wrap up the rest of the presentation we have from RSAP. So we also have like different affiliations with Data Camp, and we talked to their CEO, who also donated some of the free subscriptions to our students. And we gave these to the RSAP students based on their research experience and their motivation to be participating in such a thing in order to improve their own capabilities. And in that, we have seen that we've given over 65 scholarships, 105 courses completed, and actively we're tracking their experience that gaining so that we can actually see if it's actually beneficial. So we have a cost benefit analysis view as well of what we're giving to the students of this organization. So this is all available for all RSEP members, and it's free of cost completely. Over here, we can see a lot of these students, their reviews and such. And right now, even we have like apply now for the data camp for a year, and it's $400 completely free. Just scan the QR code. Whoever's in the seminar, you guys can do it as well. Besides that, our main committee, which is the Research and Publications Committee, and through this committee, we have already researched a few. We have published a few research papers in internationally accredited journals, and we're continuing to do so through our RPC director. Besides that, as you know, the RSNA, they're holding their annual conference. So we also have like an abstract presentation, and one of the co-presidents, Dr. Ali, he will also be presenting the abstract over there, of which he was the principal author. Besides that, we also held like SPSS masterclass session. We held that last year with our former LRP. He was able to hold a few sessions, and it really helped the students from which we gained. But besides that, we also had Dr. Omer Ali, and he had a hybrid session, and it was held at KE, in which he gave information regarding interventional radiology and pursuing it in the United States. Besides that, membership benefits, as you know, we have we share a lot of opportunities, especially this one. And Sir is taking out his time for all of you guys. And we also have a newsletter and research programs, etc. It's always being shared. But besides that, obviously, you'll get your official certification and subscription to all of the resources and the other resources that we have for us. So I hope other people in this seminar would love to join RSAP, you guys can definitely. Now over to Fiza and Dr. Omer for the official presentation. Thank you all.
Thank you, Esan, for the good presentation. All of you, let me introduce you to Dr. Awan. Dr. Omer Awan basically is an esteemed professor of diagnostic radiology and nuclear medicine at University of Maryland School of Medicine, where he also serves as Vice Chair in Education, Associate Program Director for Diagnostic Radiology Residency, and Co-Director of Medical Student Radiology Clerkship. He is basically a graduate of George Washington University and also holds a degree of MPH from Harvard University. He is an active member in AIMCRad mentorship program, as I said earlier, since 2023, and has been actively guiding us since the very beginning. He's also a senior board advisor in RSAP. Thank you so much, Dr. Awan, for taking our time and joining us. Should we start now?
Yeah. It's first of all, it's my pleasure. Thank you so much for having me. I love doing this, love interacting with the students in Pakistan, and love helping in any way that I can. So really honored to be here. Thank you.
Thank you, Dr. Omer. Now over to Momina. Momina would start taking initial questions. Handing it over to you.
Hello everyone, I am Omer Awan. I am a final year student in Every Medical University, Lahore, and I am currently serving as the liaison for a mentorship and education program at RSAP. We are very excited to have you here with us, Dr. Awan, and we have made a list of questions for you to answer and help us out. So I would, can I start, please?
Yes, of course.
Okay, so we want to ask you that how much role do postdoc fellowships play in the pursuit to residency, and what kind of research projects medical students should be carrying out if they plan to target interventional radiology in the US?
Yeah, so I think postdocs are important. They're very important. And the reason why is that because you're applying to a very competitive residency. And, interventional radiology is one year, it was actually the most competitive residency in America. I don't know what the ranking is now currently, but 1 or 2 years ago it was. And, most people that are applying from Pakistan are IMGs. So, when you're an international medical grad, you're climbing a hill, right? Or you have to overcome a hill or barriers because you're competing with US students, and they're obviously going to get priority. People that have been trained in the United States will absolutely get priority for American residency. So you have to shine above them in order to get a spot. And it's not easy. It takes a lot of hard work. It takes luck. It takes, networking. There's a lot of things and a lot of pieces to the puzzle for you to get and secure a residency spot in America. So, doing a postdoc is one way that you can show that you're highly qualified. And the reason for that is because then you get real exposure in the United States with the healthcare system. You get exposure with mentors in the system that can then write you letters of recommendation, and you can do positive things by doing research and making real contributions. So a postdoc, while it's not I mean, I wouldn't say you have to do it. It's often a means to get to your goal. It's usually a way that can really help you and really stimulate your or act as a catalyst, so to speak, for you to get to your goal. So I think it can be, especially for an IMG, I think it's very helpful. And the second part of the question was with research. It doesn't matter how much research you do or even what the type of research is. It matters that you just do it. That's the most important thing, because what is research? Research is making positive contributions to the field and showing your interest in the field and showing that you are able to, take a project from beginning to completion, and it shows your reliability, your enthusiasm, and just what you're willing to do and what you're willing to contribute. So I would say doing it is the most important thing, and having productivity is the most important thing, not necessarily the numbers. And obviously, you want to make an impact, and the way you do that is by publishing that research in important journals in our field. So, the basic journals that you should be aware of are things like, Radiology, AJR, Academic Radiology, JACR, JVIR in the case of, interventional radiology. Those are the journals you want to target to have an impact and to show that you made positive contributions to well-renowned, respected journals.
All right, thank you so much for that. Another question that we have is, how do we increase the chances of matching in radiology if we're not doing, let's say, postdoc, or if we want to increase our chances, other than postdoc, what are the things we should be doing?
That's a great question. So everything, really. I mean, everything counts. We do in residency programs, or most programs do a holistic review where we look at everything. So one way, if you're not doing a postdoc, is to do real rotations, like do observerships or rotations in the United States. That is like, in fact, in some ways, that's even more powerful than a postdoc, because, for me, I think it's extremely important and critical for you to show your presence and maintain your visibility in programs. And I talk a lot about this in many of my YouTube videos when I talk about, how an IMG can match into a radiology residency. If you guys have not seen that video, that's like a core video that everyone on this call should watch, especially if you really are serious about matching into radiology or interventional radiology in the United States, because I really try to give out all the secrets from a PD perspective on how you can do well. So please watch that. But with that said, I think it's all about increasing your visibility to a program, because when you come, let's say you do a rotation with me or at University of Maryland, then I get to see you face to face. I know who you are. I know how hardworking you are. I know how well you interact with other residents, with other medical students, with the attendings, what your work ethic is. Did you come early? Did you stay late? What type of questions do you ask? Are you insightful in the way that you're able to respond to certain questions? All these things become very clear if I see you in person. And it shows your commitment to wanting to come here if I see you in person, versus if you're just an excuse me, an AAMC ID number. Yes, I've learned about you through your personal statement, through your letters of recommendation, but it's not the same as if I see you in person. So these in-person observerships or rotations are critical, and these are an important piece of the puzzle for people matching, especially IMGs, and especially if you don't do a postdoc. And in many ways, I think that these in-person rotations and observerships are even more important than a postdoc.
All right. I also think that in-person observerships help you connect with the seniors, and that increases the chances of matching. And everyone, please make notes that you have to watch the video that Dr. Awan talked about. The next question we have is, how do we utilize the clinical rotations of our medical school, which will help us in the US electives?
Can you repeat that question again? I didn't quite understand it.
Yes, sure. How to utilize the clinical rotations of medical school, which will help in the US electives?
Well, I think, those clinical rotations that you do in Pakistan are gonna form a framework and a background for your understanding in medicine, right? So the bottom line is that, everything that you do becomes sort of like encyclopedic knowledge for you, that when you come, you integrate all those things. So for example, like even your rotations in medicine, surgery, give you a general background of medicine that helps you when you're in the United States. Like even if you're doing a radiology rotation in the United States, you have a nice background in medicine that you're able to ask informed questions to your attending or your residents because of your background in medicine, surgery, pediatrics, OBGYN, etc. So all those things can really inform your knowledge and inform your overall presence and persona as a medical student when you're doing an observership. And then also, those rotations help you because you develop an ability to, your work ethic gets developed on those rotations, your ability to complete assignments gets developed. And when you come to the United States, you're able to use that in a productive way to make a difference.
All right, thank you. Dr. Umar, what do you think makes you stand out in a radiology elective or a research conference as students who are going to apply for residency?
That's a great question. So I think what really makes you stand out is your personality and your professionalism. It's very hard to impress people based on your medical knowledge because you don't know more than most of the attendings there, or you don't, radiology is not something that's taught well in medical school. So we also don't expect you to know that much in radiology. And, there's a huge knowledge gap between medical students and residents and attendings. And that's why radiology is a 4-year residency program. And that's why, we take so much time teaching. But the way you really impress someone, or the way you really stand out, is through your professionalism, like how well liked you are, how respectful were you, how courteous were you, how enthusiastic were you about radiology, how much did you display of your passion for spirit for lifelong learning. Did you come early? Did you stay late? These professionalism issues are what make someone stand out, how well you get along with other people, how much of a team player are you. These are the things that if you show them in your rotations and in your observerships, you stand out. And these are the things that people who write letters about you will talk about when you apply for residency or fellowship, etc. So these are the critical aspects of why people match and why people don't match. It's really the personality. It's really your persona more than anything else. It has very little to do with your fund of knowledge or your USMLE score. It doesn't matter if you got a 270 or 280 on USMLE Step 1. If you come into the reading room and you're arrogant, or you don't show professionalism, or you don't show enthusiasm, then you're not going to match, in a residency program. It's literally that simple. So I think it's really your personality and your professionalism characteristics that set you apart.
Thank you, Dr. Awan. These were the questions from my side, and you explained them perfectly. I would like to hand over the mic to Fiza so she can ask some questions from you. Thank you.
Sure.
So Dr. Omer, I'll be asking you about mostly the questions related to radiology and postdoc fellowship. The question I got was that what should be your goal in a postdoc fellowship in radiology?
Well, your goal should really be to make meaningful contributions, make positive contributions. Obviously, you want to do a research project and get published. That's the goal, right? I mean, because you want to enhance your CV. You want to add positive lines and experiences to your CV. You get that by being an author, in a peer-reviewed publication. Ideally a first author, but not necessarily, right? So you want to, and the more you get of those, the better, obviously. I mean, you don't have to do like 15 or 20, but like you want to have several, and I think that's the primary goal. The primary goal is for you to, take a project to completion, show that you're reliable, show that you're dependable, and show the fruits of that on your CV by having peer-reviewed publications, and maybe even getting presentations, being able to give an oral presentation at a major meeting, like we talk about RSNA or AAR, excuse me, ARS Sim, the Society of SIR, whatever it may be, right? So that's the primary goal. But the secondary goal, which is equally important, is showing yourself in a way that you earn and deserve an amazing letter of recommendation from your mentor. That is key because the better you do, the more likely you are to match. And let me explain why that's the case. Because if you're someone that is reliable, dependable, you're motivated, you show that you have an impeccable work ethic, well, that's going to be reflected in your letter of recommendation by your mentor or your preceptor that's writing it, right? And that's going to add, the letters of recommendation are extremely important when program directors are looking at your application and offering interviews. So the stronger that letter is, the more likely you are to get a letter, to get an interview, excuse me. And the stronger your relationships are, like if you develop good relationships with residents that are in that department and your mentors and their friends, then the more likely those mentors are to go above and beyond for you. The more likely it is that that mentor of yours will try harder to get you a residency spot. The more likely it is that that mentor will maybe make a call on your behalf or email a program director to say, hey, I think Armin Masood is amazing. She was very hardworking. She's dependable. Please offer her an interview to the residency program. These things happen the harder you put in, right? The more work you put in and the more effort you put in, the more likely it is that your mentors will go to bat for you or will try to support you in a way that will be successful and meaningful to you. So there's primary goals that I talked about, and those secondary goals are equally important. And usually it's those secondary goals that allow you to get over the hump to eventually get a residency program.
Understood. It makes sense. Another question is that what is the impact of USMLE attempts on your application while you're matching for radiology, and how do you overcome that?
Okay, so you should really try to pass on your first attempt, right? So, the USMLE, I know step 1 is pass fail. Step 2 is a grade, a numerical grade. You're applying to an extremely competitive program, residency. Radiology or interventional radiology are extremely competitive, and you're an IMG, so you're already at a disadvantage, to some extent when you're applying. So if you have to do it again or a second time, then that becomes a red flag, unfortunately. I just want to be honest. It becomes very hard to match into radiology, even as a US student, if you've failed once. And then as IMG, much even harder, right? So I'm not saying it's impossible to match after you've failed an attempt, but exceedingly difficult, extremely difficult to match, if you have not passed your USMLE or if you've gotten a below average score as an IMG, because you're already you have to show as an IMG that you're better than these US students or that you're an exceptional person. And this is why, you're not applying to family medicine, you're applying to radiology or interventional radiology, which are highly competitive and sought after fields here in America, right? So you have to really have an impeccable and an outstanding portfolio when you're applying. So if you do end up failing, then you have to make it up in big ways. Like you have to, on the next step, you have to do exceedingly well. You have to have published many more papers. You have to have had postdocs. You have to have mentors that can vouch for you. You have to have done observerships and people love you, like not just think you're good, like they love you and they think that, wow, this person really should be in our program, or they get along with everyone. They would be an incredible student. So it's not the end of the world, but it makes it very hard. It makes it extremely difficult for you to really succeed if you have to take multiple attempts for the USMLE. I mean, I'm just being honest. There's no other way out of that.
Thank you, Dr. Omer. Another question is about interview tips, since it's an interview season. So somebody has asked that how to express yourself in a way that they actually believe that you are the best candidate for the program.
Yeah, so I think, so again, I want to plug in my YouTube videos because I have a lot of videos about this. And the interview is critical, by the way. So just so you know, I think personally, the interview is the most important aspect of whether or not, once you get an offer, like let's say once a program gives you an interview, the interview then becomes the most important part of your application in terms of whether or not you will match or what your position will be on the rank order list. It becomes the most important thing. And I explain why that's the case in my videos. And I also explain in a lot of my YouTube videos, it's called the Med Ed page, in case you don't know, MEDEDPAGE. I have tons of videos on the interview process, like how to ace your interview, what to do, what not to do. Please watch those because I honestly, there's not much on YouTube out there about this topic. And this is a critical topic. And, coming from a program director who's trying to just give all the secrets away, it's a must watch for all of you, all 45 of you on this call. But with that said, I think what you have to do is you have to do it in a way that is conversational. You need to have a conversation. It shouldn't feel like an interview where it's just question, answer, question, answer, question, answer. It should really be a conversation. It should be a dynamic process between two people. Like, it shouldn't be like this. Like, what's happening right now is not how your interview should be for residency, right? Like, you guys are asking me questions, I'm giving you answers. Questions, answer. This is like a Q&A session. That's not the way your interview should be. It should really be like a lively discussion where two people are getting to know each other. Those are the best interviews. And the way you do that is by being comfortable, by practicing, by really having people practice, get feedback from people, do mock interviews, and just know your strengths, know your application, and try to be comfortable. Try for it not to be so rehearsed. Of course, you need to prepare, but don't over prepare. I talk about that. I talk about the balance between preparation and spontaneity. That's one of the things that I talk about in my videos. And I think that's important because when people come off too polished or too rehearsed, that also looks bad. And when someone comes off as, not prepared at all or just kind of too nonchalant and not worrying about it, that also is a problem. So it takes practice to kind of get into that middle path or middle ground where it just is very natural. And of course, smiling, all these things make a difference. Smiling, showing interest, asking the appropriate questions, knowing how to give the response, even how to answer, tell me about yourself, which is another video that I have, which a lot of people don't do well on. You'd be surprised that, we've already done like 50 interviews. I've interviewed about 50 people already during this block of interviews or this season. And very few people answer the question correctly about tell me about yourself. And I have a whole video on that, on how to answer that appropriately, right? So there's so many things that you can do to enhance your interview process. But practice makes perfect. So practice, get feedback from somebody, and watch those videos on my channel. They will really help you succeed and take your application to the next level.
Thank you so much for the wonderful tips, especially the contrast between overdoing and underdoing. Another question that is about majorly the radiology, that considering the integration of artificial intelligence in radiology, what do you think is the fate of future radiology?
Listen, I think the fate is great. I think that there's a huge future in radiology. We talk about artificial intelligence and we talk about, some people have said, people said about 7 or 8 years ago that artificial intelligence is going to replace all radiologists. Has that happened? No. The answer is no. And in fact, there's a shortage of radiologists. In fact, that people are begging I don't know what it's like in Pakistan, but in America, there are so many more jobs than there are radiologists. In fact, we have a shortage of training. We want to train more radiologists, and it's so easy. The market is blooming here in America, where people are offering, the salaries are high here. They give you sign-on bonuses. I mean, it's like we've never seen this in radiology in the last 20 or 30 years. There's such a high demand for radiologists because so many studies get ordered nonstop. So my sense is that this is just going to continue. Radiology is going to help us do our job better. It's going to augment our practice. It's going to allow us to be more efficient. It's not taking our jobs away. This is kind of similar to when, Y2K happened in the year 2000. Many of you may be too young for that, but, people thought that, when the internet is going to replace so many jobs, but look what happened. Like, the IT world bloomed, right? I mean, it created more jobs. And I think the same is true for radiology. To me, there's no threat of AI and radiology. Radiology is like, I can't think of another field in medicine where medicine the hospitals rely more on. We serve all hospitals. We serve everyone. You know what I mean? Like, it doesn't matter if you're a psychiatrist, a surgeon, an internal medicine doctor, a family doc, OBGYN. The hospital relies on radiology, right? And there are just more and more studies that are getting done nonstop. So, your job is secure in radiology, and certainly my job has been secure for radiology. So I hope that's clear to everybody.
Yeah, also another question about AI is how is AI actually helpful in radiology nowadays? Can you give a light on that?
Yeah, so many ways, right? So first of all, we're only beginning to understand how helpful AI is in radiology. AI is very helpful in a lot of ways. One of which is it helps us make diagnoses, right? So it can detect breast cancers on a mammogram. It can detect, bleeds on a head CT. It can detect a fracture on a X-ray of the hip or something. It can detect a pneumothorax on a chest X-ray, right? So it allows us to be more confident in our diagnoses. That's number one. Number two, it can help triage workflows. It can make us more efficient by, showing us the findings faster so that we can get through studies faster. Okay. It can help us with dictations, structured reports, by AI can auto-populate certain things, faster to make us more efficient as well, right? It can help with, let's say let's say you're interventional radiology and you have to type a progress note, or you have to do, it can literally tape or record your encounter with a patient and auto-populate a note for you. So you can see that there's so many applications, drug prescriptions, prescribing drugs if you're an interventional radiologist. I mean, there are so many ways that AI can help, automated chatbots that can help answer questions for patients before procedures, for diagnostic radiologists and interventional radiologists. I mean, I've already listed 5 or 6 major applications, and there's many more. Okay, so AI can be very helpful in our ability to do our jobs better and more efficiently.
All right, understandable. Another question is about work-life balance. Someone has to know that about a day in life of a radiologist as a resident and attending. Just
So
a brief overview would be nice.
Yeah, so I mean, I can just tell you mine. Everyone, radiology is interesting because radiology is very different for everybody. Okay, it's extremely different. So depending on if you're a diagnostic radiologist, if you're an interventional radiologist, if you're I'm a diagnostic musculoskeletal radiologist, and I'm in academics. I work at University of Maryland Medical Center. My life is going to be different than a private practice radiologist who works also in Baltimore, who's general. It's different than someone who works in the community radiologist. It's different than someone who works interventional private or interventional community. But what I will tell you about my life is I work 8 to 5. I work Monday through Friday, 8 a.m. to 5 p.m. So I never work evenings. I never work nights. But not all. Some radiologists. So when I first started, my first job at Dartmouth was I worked nights. I worked 1 week on, 2 weeks off. So I actually worked overnight. I worked 9 p.m. to 8 a.m. for 7 nights, and then I have 14 days off. So that's actually how I started my career. But now, I have a family. I'm married. I have kids. I have 4 kids. It's hard to do that when you're married and you have kids. So now when I work Monday to Friday, 8 a.m. to 5 p.m. And I never work evenings. I never work nights. I do have to work some weekends because I have to take calls. So every 6 weeks on the weekend, I'll take a call. I'll take Saturday and Sunday, but I'll also work Saturday 8 to 5, Sunday to 5. So my life is nice because I only work during the day. I don't work evenings. I don't work nights, right? So that gives great. I mean, for a physician to do that, that's pretty impressive, right? Because surgeons have long hours. Even medicine doctors work 7 to 7 sometimes. The hours can be very brutal if you're. So radiology actually I think has very nice hours. And even my and that gives me a lot of time to do other things. So like just to give you an example, I'm married. I have 4 kids. I get to spend a lot of time with my kids. I get to help them with their homework. I get to help my wife. I teach at Sunday school at the local masjid, at the mosque on Sundays. I teach, Quran and Arabic on Sundays. I get time to do that, obviously. I get to do a lot of things. I get to do a lot of this media stuff where I write for Forbes and, come on the news and stuff because I work 8 to 5. I can do some of these other things that I really want. These are my passions, and I'll give you another thing. So my younger brother is an interventional radiologist. So my younger brother, who's 3 years younger than me, Yusuf, he's an interventional radiologist, and he works he's not in academics, but he works in a community hospital. So his hours are also very good. He works more or less 8 to 4:30. Actually, his hours are maybe even a little less than mine. He works at Sinai Hospital in Baltimore, which is, a hospital also in Baltimore City, but it's not academic. But he does have to, he does have to take call, and because he's an interventional radiologist, he may have to come in the middle of the night to do a procedure. I never have to do that. I never have to really come in the middle of the night ever, So, my brother, because he has to do it, he's interventional radiology, he has to sometimes come in on the middle of the night, and that's okay for him. But, his hours are also very good. So, but that would change if he was an academic IR. If he was academic interventional radiology, maybe the hours would be a little worse, So it honestly depends on what you want to do, whether you're academic, private practice, community-based hospital. Maybe teleradiology is another option. Some people work from their homes. They work, whatever hours they want to do. So it's highly variable depending on the job that you have and what type of meaning you want to have in your life.
Thank you, Dr. Omer. That was a very brief answer. Another question is about AI, that how should we go about pursuing machine learning or artificial intelligence research in radiology? Are there any particular programs at university, for example, where we can get involved in such research?
Yeah, there's so much research that's going on with AI, machine learning, convoluted neural networks. All those things are happening, and they're happening dynamically. First of all, there's a lot of courses on AI. The AI, there is RSNA has an AI course. University of Alabama has this AI literacy course, which actually I was a part of. I taught one of the sessions on the University of Alabama AI literacy course for a lot of residents in throughout the country. The SIM, the Society of Imaging Informatics and Medicine, has an AI course for all residents, for radiology residents. It's a partner with RSNA. RSNA and SIM have this, course for AI, artificial intelligence. So there's a lot, and there's a lot of research that's happening in AI. So even at University of Maryland, here we have a lot of faculty that have grants that are studying AI, artificial intelligence with respect to trauma, neuroimaging, et cetera. Almost every institution has a lot of research with respect to AI, machine learning, and those type of things. And, it's important to do this sort of research because this is going to be the future of our field. The way artificial intelligence and how it's being used in radiology will absolutely be the future, and how, so we should be ahead of the curve and participate in this research and train people in how to do this, right? So there's so much going on. It's very easy to get involved in this. This is not a hard thing to do. It's just a matter of you asking who's doing it and get involved, and get the appropriate training for it.
Thank you, Dr. Awan. Another question is about DR, that in regards to research, would you say it's important that research is important for diagnostic radiology as well? And another question is, and at the part of it is there a difference between observership and electives for DR?
A difference between observership and elective for DR. Yes, there is a difference, but functionally there's not. So let me answer the second part of the question, because I didn't quite understand the first part of the question. But pretty much the most important thing is for you to do something. You know what I mean? Like, the important thing for you to do is to make your presence known. It doesn't matter if it's an elective. It doesn't matter if it's an observership, because as an IMG, they're going to function almost as the same way, because it's to show your appearance, to make yourself visible to program directors, to residents, etc., so that you have a chance. You're trying to give yourself a chance to match into the residency program, right? So you do that by showing up, by being there physically. The difference between an observership and an elective is really subtle. It's just that an observership, you're not really getting graded. It's not going to be part of your medical school transcript. Whereas if you do an elective, it's usually a relationship or some sort of communication that has been worked out, or an agreement that's been worked out between the place you're doing it and your medical school, so that maybe you get a formal grade. That's what an elective is, right? But an observership is just, kind of something that's done, that's not really necessarily part of your curriculum. It's not necessarily part of your formal grade for your medical school, but you may get evaluated, and it gives you an opportunity to make yourself known and to show your interest and to, participate in 4 weeks. So the important thing is to do one of them. It doesn't really matter if you do an elective or an observership. It's important for you to do something. That's the key. And so I don't really like to make a distinction between an observership or an elective, because they're both helpful. They're both helpful in a big way, especially for an IMG. What was the first part of that question? Because I didn't understand the first part of that question.
The first part of the question was that in regards to research, would you say its importance is same for diagnostic radiology as IR?
Yeah. Research is important. It doesn't matter if you're applying for DRI because they're both competitive. IR may be a little bit more competitive, but the bottom line is, as an IMG, you need to do research. It's important because it shows that you're going above and beyond, because research isn't mandatory, right? It's something that you're showing that you've done outside and it's helping you in a big way, right? So, and even now, it's getting so much more competitive to match into DR and IR. Like, I mean, this year alone, we got like 1,200 applications to University of Maryland. You know, we only interview about 100 or 130 of those 1,200, right? So that's competitive. That means only less than 10% of people that are applying are getting an interview, and only 9 people are matching. I mean, it's hard, and a lot of students are doing research. Even US students are doing research. So if US students are doing them, you have to outperform them, right? So that's why research is important. I mean, when I applied to residency in 2008, 2007, 2008, I had no research. I did zero research. I had no publications when I applied. And obviously I matched, but I'm also a US citizen. Like, I did my training in the US. I did my medical in the US. So I wasn't, fighting against IMGs, because I knew I was going to be, looked at more favorably because I did everything here in the United States. But for you guys who are doing it there, you have to really show that you've gone above and beyond, that you're more qualified than the people here, if that makes sense.
Yeah, thank you, Dr. Omer. And another question was about interviews and signaling. What do you think about signaling, and do you think that signaling has affected IMG's chance to get more interviews?
Yeah, I mean, I think signaling is important, right? You're given, 6 signals, you're given 6 gold and 6 silver signals. You should use all of them. They're an opportunity for you to show your interest and to flag your application to a program director, right? So if you can flag it and you can show that, hey, like, I gold signal you, then they will probably take your application more seriously, right? Especially if you're not known to them, like, especially if you're an IMG, if you do a gold signal, then that shows that you're really interested in the program. And oftentimes, a program director will look at all the goal signals first. When they're looking, because we get 1,200 applications, maybe only 106 goal signaled us. We'll look at those ones first and make a decision on, okay, do we want to interview them or not? You know what I mean? So I think it gives special attention to your application, whether it's gold or silver. So I would, you definitely don't want to leave any signals blank. You want to use all of them there, consider them and treat them as a gift or an opportunity for you to show your interest.
Okay, thank you. Makes sense. Another question is that what do you think would be the appropriate questions to ask the program director in a radiology interview?
There's many questions you can ask. Why do what is there to do in this city? You can ask things like, what is a commitment to this residency program to wellness or to diversity or to these type of things? How much support is there, or what opportunities are there for residents to teach? I'm interested in global health. What global health opportunities are there in this residency program, and how is that supported throughout the curriculum? Does this program offer, opportunities to train in both, nuclear medicine and diagnostic radiology simultaneously? If you're interested in interventional radiology, can you tell me about the ESIR program? What are the strengths of this program, or what are you most proud of this residency program? These are just some of the questions, that you can ask. What educational development programs are there for residents? How are they supported in pursuing education, et cetera? These are just some of the many questions you can ask.
Understandable. Another question is that what are the expectations held from a medical student regarding knowledge and experience in radiology when you are applying for match?
Can you repeat that again for me?
Yeah, sure. The question is that what are the expectations held from a medical student regarding knowledge and experience in radiology when you are applying for match?
For radiology, minimal. For radiology, we don't really expect much aside from the fact that you've finished medical school. You know what I mean? So from a medical school perspective, because you don't really learn radiology. I mean, radiology is not part of the core curriculum in anything really for any medical school. You know what I mean? So we just expect you to have a basic understanding of medicine, when you're applying. So the expectations are very low for radiology, because we understand that, we are teaching you a new language, quite frankly, when you come in and you learn from us.
Understandable. Another question is that how does networking help from the very beginning in medical school to the match season and afterwards?
It's critical, huge. Networking is a big thing, and maybe we haven't touched on this enough, but networking, like anything in life, right? Like if you think about, you know, major positions that people get, and if I think about the things that I've gotten in my life, the thing that the position that I've gotten, much of it, I mean, part of it is your credentials, and part of it is your hard work, and part of it is the results that you've done, like maybe your board scores or your grades or so. But a lot of it has to do with who you know. It's like anything in life, right? It's like your connections, who you know, how many people you know. So the more people you know, the more friendly you are with people, the more connections you made with other program directors, students, residents, the better off you will be, right? The more likely you are to match, the more likely you are to get interviewed, the more likely you are to be seen favorably. So the more networking you do, the better, because it opens opportunities. It opens doors for you that you may not know. Like if you network with some mentors, they may be able to put you on a paper or give you a project. They may be able to introduce you to somebody else that you otherwise wouldn't have met, right? That may offer you an interview. So it's like networking is like a branch, right? It's like trees that it's like these branches that offer you other opportunities that you wouldn't know that existed without that networking. That's why networking is it's critical. Networking is critical for your success. That's why going to these conferences like RSNA or AUR or ARS or SIM or SIR or Society of Abdominal Imaging. All these are critical because they help you meet people that then open doors for you. They open opportunities for you to succeed in the future. So this is why networking is extremely critical.
I totally agree with you. Another question is about interviews that I would like to ask. What is the safe number of interviews to match in radiology?
I've learned that there's nothing safe, unfortunately. You know what I mean? So, I used to tell people if you go on 15 radiology interviews, you're safe. But I've mentored students who have gone on 15 and they have not matched, which I think is crazy. I mean, I think it's insane that because things have gotten so competitive. I mean, I went on 15 interviews. I've usually told people if you go on 15, you pretty much have a 97% chance of matching. There's always a chance that you don't. But I mean, you can't go on 50 interviews, that's impossible, right? I mean, but I think if in a ballpark of 15, if you've gone on 15, that's probably good enough. You know what I mean? And then obviously some people, very rarely you may not match, and that's just part of life. You know what I mean? Because it can be, the process can also be luck too, But I think if you go on a 15 or 16, you will likely match. It would be, unless there's some big red flag in your application or you just didn't do well on your interviews. I have mentored people, U.S. students. I just last year I mentored somebody from GW, George Washington, which is where I went to medical school. He went on 15 interviews and he did not match, and I was surprised. And his board scores were fine. They were average to above average, and he went to GW, a good school here, and he didn't match. And then I mentored him. And then the following year, this past year, he did match. He matched somewhere, so I was very happy for him. But sometimes it happens. But usually if you go on 15, 16, you have, I mean, if you're only going on 6 or 7, then that significantly decreases your chances, right? But 15 and above, I think you're good to go.
Yeah, I totally agree with your point that there is nothing black and white. Another question is about can I go into radiology after doing IM residency in US first, like matching into radiology after doing your IM residency? Is there an alternative pathway?
Yeah, I mean, you can. You just have to apply. You know what I mean? You have to apply again, and that's fine. I've seen people who've done surgery or have done, 1 or 2 years of surgery and then have changed fields and come into our program. That's happened before. There's precedent for that. So yes, it happens. But that depends on you. It depends on, are you willing to continue being a resident, because being a resident is hard. The hours are longer. It's hard work. You're learning. So and the pay is obviously not as much as, what you would get as an attending. So it depends on you, your life situation. Do you need to provide for your family? Are you married? Do you have kids, etc.? So all these things play a role. But is it possible? Yes, it is possible. It's happened before. People have finished residency and applied to a second residency. People even have left residency in the middle and applied. And sometimes it might be a little easier because let's say you're at an institution, maybe you have connections there, maybe you've met people there, and they know who you are. So maybe it becomes easier for you to get into the residency. But it's on a case-by-case basis, really, and it depends on you and your personal life and what you can handle. But is it possible? Yes.
Understandable. Another question is that how much your school MSP and your school RAC matters in match.
Your school, what? I couldn't understand what you said.
Let me repeat it. How much our school MSP and the school RAC matters in math cycle?
MSP is like the medical school performance evaluation, right? Yeah. So
Yeah.
yeah, it matters. That's like your dean's letter. That's an important part of the application. All program directors read that. We read that carefully to make sure to see what your dean is saying, what your evaluations were, what your on your rotations, all your comments about your rotations get put on that MSPE. So all that matters. It matters big time. It matters a lot. And then your school matters too. The reputation of your school matters. How good your school is. Everything matters. The bottom line is everything matters. Everything gets looked at. Everything gets taken into account. Everything gets, we look at everything before we make a decision on whether we want to interview people. So these things are critical. So I would say it matters.
Understandable. Another question is about STEPS exams. How much it matters to pass the USMLE exams during your graduation year, and how does that help?
Say that again.
The question is that how much it matters to pass the USMLE exams during your graduation years, and how much it helps later on.
I think someone answered this earlier when someone asked the question about, the USMLE and, whether multiple attempts, but you can't apply to a residency without having passed step 1 or step 2. You know what I mean? Like, you can, but you're not going to get an interview. If you don't have a passing step 1 score and a step 2 score, you're not going to get an interview almost anywhere. You know what I mean? Like, people who would try to apply to residency and they have not passed step 1 or they have not shown a step 2 score, we don't know whether off your interview. The board score is a major part of your assessment, right? So we need to make sure that you've passed step 1 and then you have a step 2 score, or else we can't compare you with other candidates, right? So it's critical. It's critical to pass that and try to pass it on your first attempt.
Yeah, I think they meant that how helpful it is to clear your steps as early as possible. Because mostly students in Pakistan, they don't take steps in graduation year. They focus it on after graduation year. So
You should clear it before you pass. Excuse me, you should clear it before you apply. You should clear your at least step 1 and step 2 before you apply. Whether or not you do it during your medical school or after, I guess it doesn't matter for us. We just want to have a score. You know what I mean? Like, we want to have, you shouldn't take like 10 years after you've graduated and then do it. That doesn't look good either, but you should really try to do it as soon as possible and certainly do both before you apply to residency.
Understandable. Another question is about MIT Medical Imaging Technology. That as an MIT graduate from Pakistan, what are the future opportunities for us in USA?
What do you mean by MIB? I don't even know what that is.
MIT is Medical Imaging Technology. It's a degree in Pakistan, yeah.
So what's the question again? The question is,
as an MIT graduate from Pakistan, what are the future opportunities for us in USA?
I don't think it's any different than anyone else, quite frankly. You know what I mean? I didn't even know about it until you just told me about it. So I think the bottom line is that, the opportunities are endless, but they're endless for everyone. I don't know that having an MIT is any different than somebody else applying from Pakistan. Or maybe I just don't understand the question. But yeah, I don't think it's anything different than anyone else.
Okay, understandable. Another question was about your MPH, that how was your shift from MPH to radiology? What brought you into radiology after MPH? So a little light on that, please.
Yeah, sure. So I actually did my MPH after radiology. So I did my MPH when I was already attending. At that time, I was in Philadelphia. I was at Temple University. I was a radiologist there, and I did my MPH as online, but some part-time in person in Boston, but mainly online. So I did my MPH later, like from 2016 to 2018. I did my MPH, but I graduated residency in 2013. So I did it 3 years after I graduated residency. For me, I just love public health. And that's why, I wanted to always be a public health advocate. And this is why I write for Forbes and I come on news and stuff, because I have a passion for public health. So I thought that getting an MPH degree would help me fulfill these passions. So I did it actually after the fact, after residency. Public health is extremely critical to radiology, because when we talk about things like screening for lung cancer, mammograms, healthcare disparities. This all relates to radiology and imaging. So I think it's critical for us, and there is an avenue and a path for people to do that.
Yeah, understandable. For everyone here, Dr. Omer is basically a senior contributor for public health in Forbes, and he's also a TV on-air medical expert in Scripps News, and he has done a lot of work in public health as regard of that matter. Another question is, the last question, for a matter of fact, is why radiology?
I love it. I think it's the best field. It's the best field of medicine. First of all, it's an opportunity for you to have a positive impact on patients. No matter, like we kind of talked about earlier, no matter whether you're in surgery, medicine, psychiatry, OBGYN, everyone relies on radiology to help, right? So we're kind of like the doctor's doctor. We look at everything, right? And I've always been like a cerebral person. Like I like to figure things out. Putting the pieces of the puzzle together. That's kind of what radiology is for me. It's kind of like doing detective work, like figuring out what's wrong and then formulating an answer to help people. It's also very versatile. Like, you get to read studies, you get to do procedures. I do steroid injections, joint aspirations, sometimes biopsies, for bone biopsies or ultrasound tumor biopsies. It's very flexible and versatile. And then lifestyle is very good, right? Like I work 8 to 5, I have a family, I do other things, I do it gives me time. Like, so I'll share this with you guys since, you guys are all Muslim, like I'm a Hafiz of Quran. So I revise Quran daily. So I spend an hour of my time just reviewing 1 or 2 sabatas a day. I can only do that because I work 8 to 5. If I was a surgeon, I wouldn't have time to do that, right? So for me, it's critical that, radiology has allowed me to do all these other interests that I have. So this is why I did radiology. I love it. It allows me to do what I love, spend time with my family, and do things that I'd like to do on the side.
Thank you so much, Dr. Awan. This was really inspirational. Thank you so much for taking our time and joining us. I think we are done with most of the questions. If you have anything else, any tips, any guidance you want us to give, please do share.
Listen, it was my pleasure. My goal has always been to help Pakistanis. I'm Pakistani. I'm not an IMG, but my father, went to King Edward and he came here and he gave me a great life. And this was my way to pay my father back, for the great life that he gave me. So I'm very passionate about trying to help as many Pakistanis as I can. I understand the struggle. So it's also why I made this YouTube page, mainly for IMGs, quite frankly, to help IMGs and to help people like yourselves, So please look at that. That is something that I wish I had when I was a student, but nobody had that resource when I was a student. I think things have changed a lot, and there's a lot of stuff out there. So it's an honor. It's a pleasure to do this. I'm always happy to do more if you guys want me to do more. And all the best, inshallah. And always, if the one advice I have is just put your trust in Allah subhanahu wa ta'ala. This is nothing happens except by the will of Allah. And you have to rely on Allah subhanahu wa ta'ala for everything. And I've learned that the good way and the hard way, quite frankly. So all the best to you and wish you nothing but success in your future, inshallah ta'ala.
Thank you so much, Dr. Awan. Guys, please do follow Dr. Awan YouTube page. It's MedEd. We'll also share the link in group. Thank you so much for the time, Doctor.